program is called Sew Up the Safety Net for Women and Children, and it really is an unprecedented partnership between the 4 Detroit-based healthcare organizations, as well as our public, academic, and community partners, to link very vulnerable at-risk women that are either pregnant or in between pregnancies with needed human and social resources. In Detroit, we have had for actually a couple of decades an appallingly high infant mortality rate. Now, when I say infant mortality rate, that means an infant dies before its first birthday. The 3 most important things that will come out of this program are, 1, we're going to be connecting these women to services, and with the intention of measurably decreasing and hopefully eliminating the infant death rate or infant mortality rate in 3 very at-risk neighborhoods in Detroit. Another key element will be we're having a very full, comprehensive social marketing or social media campaign where we're giving women cell phones. We're going to send them text messages through Text for Baby. We're going to be communicating using the social media vehicles in order to engage these women in the long term. During our media tour, we had the opportunity to convene a group of people from all of the different health systems, from our local and state health department. Actually, Director Olga Dazzo from the Michigan Department of Community Health joined us on the school bus, and we had a chance to go out into the community to a site where some of the services, one of our neighborhoods where the services will be rendered. And I think some of the take-home aspects of the day was it was wonderful to see people's reactions as we drove through some of the neighborhoods. We stopped at a restaurant during the tour and had the opportunity for several of the neighborhood leaders to talk about their experiences and a little bit about their neighborhoods. The owner of the restaurant refused to, she served very nice refreshments to the team, to the group, refused to take any compensation and said she would actually like to be involved in the project at some level. So one key message also is that there are a lot of assets in these communities. In terms of when we expect to see results from the project, well, one of our outcomes is the reduction and ultimately the elimination of infant death. So we know we won't see the results of that for at least a year because we will recruit women, and of course they have to go through a hopefully 9-month period of pregnancy, and then we will follow that pregnancy in terms of its success. But then we'll also need to follow that infant for a year after that.